All right, everybody. Sorry about the delay here. Dr. Patel here, wishing you a happy Good Friday and Easter weekend. We're here today to talk about ligament injuries and what are the different treatment options that are available for them. In a previous session, we talked about hypermobility and what exactly that means. When it comes down to it, a lot of folks reached out and said, hypermobility sounds like something that I have. So what do I do about it? And, I kind of wanted to couple that with other ligament conditions such as sprains and tears and whiplash. And what are all the different treatment options that are available for that? As well as what are the things that we should not do? What are things that could potentially cause more harm than good? So if this is something that you find interesting, if this is something that is beneficial for you, or you think that could be beneficial for anyone else, then please like it, share it, subscribe to my station channel or whatever this is called, and spread the word, because I think this is actually an important topic that oftentimes gets neglected when we think about various pain conditions. So, first and foremost, I just kind of want to recap what ligaments are, what ligaments do, and how ligaments can get injured. What exactly happens when we have ligament injuries, and what are the different categories that those ligament injuries can fall into. So first of all, what are ligaments? What is it that ligaments actually do? So, when you think about ligament structures, ligaments are actually a soft tissue structure, and ligaments are the thing that connects bones to bones. So, when we think about different ligaments, a lot of times people think about the knee and the different ligaments that are involved with the knee, including the big guys such as your MCL, your LCL, your ACL, and your PCL. Okay. And these stand for the medial collateral ligament, the lateral collateral ligament, your anterior cruciate and posterior cruciate ligaments. And these ligaments are the things that provide stability or security to joints, right? And in this example, these are the knee joints. And ligaments, a lot of people describe this as the duct tape that connects bone to bone. But in actuality, and you've heard me say this before, if you've ever tuned in, or if you're my patient, you've heard me say that ligaments are not really like duct tape, but they're actually like those thick rubber bands that surround broccoli in the grocery store. So there is some stretch that is involved with these ligaments. These ligaments are tight, they're strong, they're supportive, but there is some stretch that is involved. And we have these ligaments connecting all of the various bones in our body. So you have these ligaments connecting areas like your knee, but you also have these ligaments connecting things like your vertebral bodies and other parts of your spine. So if you think about the spine as a stack of bones, and you have the discs in between the stacks, you have ligament structures that connect these bones together. And these ligaments surround various different areas. The spinous processes, these ligaments surround the vertebral bodies and the discs themselves. These ligaments connect the transverse processes. All of these different parts of the bones are actually connected by ligaments as well. So ligaments are actually a really integral, important part of the whole picture. We can get various different types of injuries to the ligaments that take place. Danny, thanks for stopping in the comment. You said that you're struggling with whiplash symptoms. Well, whiplash is a pure example of how the ligaments can get injured. Now, whiplash can be multifactorial. Whiplash can involve injury to other areas as well. And I have a video somewhere on my page, or you can always find my old videos on YouTube or on our website, fxregencenter.com. But I have a video specifically on whiplash and the various different things that could get injured as a part of whiplash. But whiplash ultimately, one of the fundamental things that we think is involved as a part of whiplash is an injury to the ligaments. And whiplash, for those of you that may be unfamiliar with the term, involves an injury to the neck, typically with activities such as car accidents, injuries or traumas such as car accidents, or even other things that can essentially whip the head around. I've seen whiplash injuries with patients that were dancers. I've seen whiplash injuries when patients have had concussions from head injuries, whether it's a fall and hit on the head, or a football player getting a concussion, or a boxer getting hit in the head can cause whiplash type injuries to the neck. I've also seen whiplash injuries for even so seemingly more benign things that in theory, or in the way it's used right now in the world as a treatment for neck pain, can actually cause whiplash type conditions, and that's like high velocity adjustments that are done by manual practitioners such as chiropractors and others. So whiplash ultimately involves the stretching of these ligament structures. And whiplash may or may not involve actual injury to the ligaments, but imagine those rubber bands suddenly getting stretched. Sometimes those rubber bands can actually get tears in them, or sometimes it's as simple as those rubber bands getting looser. And secondary to that, we see a lot of other things take place. So for example, if you have a whiplash injury of your neck and those ligaments around the joints get looser, then the joints themselves can start causing pain. If the ligaments around the discs get looser, well, then the discs themselves can get injured. Number one, the discs can bulge outwards. Number two, or number three, those discs can actually even temporarily bulge outwards and then go back in, but in that process can irritate the nerves in the neck. And then finally, the ligaments themselves can become pain generators if little micro tears or sprains occur, or if more major tears occur as well. Now, similarly, repetitive stress or repetitive trauma to other areas can cause ligament injuries as well. So a pure example of a ligament injury is somebody that has elbow pain when you're a pitcher. And you may have heard of the term Tommy John surgery. Well, that involves an injury to the ligament called the UCL, or ulnar collateral ligament of the elbow. And what happens is when these pitchers are going through this motion, and that stress of bringing that arm backwards before throwing the ball, that bringing the arm backwards actually stretches that UCL, and that ligament, especially with these repetitive motions, that rubber band is slowly getting stretched, and eventually over time that rubber band either gets loose or snaps, and a tear occurs in that ligament, which then, if not treated appropriately, may actually need surgery. Now, surgery for something like that is not the best. It is something that's sometimes absolutely necessary, but sometimes it is something that is done kind of preemptively, particularly when we talk about these athletes, and unfortunately it's something that can actually have long-term repercussions. After this type of surgery, if somebody has a re-tear of that ligament, it could become a major issue, and a repeat surgery ends up becoming a whole other ball of wax with a longer recovery and potentially not being able to return to sport. And then ligaments such as the knee can get injured with various different things, right? You think of anything from skiing to sports to even just twisting your knee in a pothole in the ground, you know? Various different things can cause ligament injuries. And again, that could range from the ligaments being stretched all the way to ligaments being torn. So now that we know the different types of injuries that could occur to ligaments, and now that we know what ligaments do and how they work, well, what are the different treatment options that are available for ligament injuries? Now, traditionally, depending on the specific ligament injury, we tend to go in a couple different directions. Before I go on, one very, very, very common ligament injury that almost everybody ends up getting in one way, shape, or form in their lives is a sprained ankle, right? A sprained ankle, if we twist our ankle, is an injury to the ligament on the outside of the ankle called the ATFL. The second most common ligament that's injured in that area is called the CFL. And these ligaments essentially, again, are the duct tape that connect bones to bones. But when the ankle twists, when you walk funny, or when you twist your ankle in an abnormal way, those ligaments again can get stretched, micro tears or major tears in that area. So what happens when that ligament injury takes place? Let's think about that sprained ankle. Well, when that injury takes place, number one, there's swelling that's associated with it. And oftentimes it's very, very painful, and it's kind of tender to put your foot down. And there's some instability that's associated with it, particularly when that swelling starts to go down over time. So historically, we have treated these type of ligament injuries with things like rest, ice, compression, elevation. So your RICE type protocol, right? And oftentimes in association with that, we put in non-steroidal anti-inflammatory medications like ibuprofen, Motrin, Aleve, Advil, etc. Why? Because we have that swelling, we have that inflammation going on, so we put that medication on board in order to decrease the inflammation. Historically, also for certain things like twisted or sprained ankles, also things like ligament injuries of various other areas like the knees and even the neck, immobility or compression and immobility have oftentimes been a part of the picture as well. So what does immobility look like for an ankle? Well, it could be as little as an ACE bandage wrapping around, or historically what people have done oftentimes is something like a walking boot, like an orthopedic boot, to completely take pressure off of that ankle. Or in the knee, it would be something like a brace, all the way up to potentially something that completely immobilizes the knee if we think that the injury is significant enough. Or in the neck, it would be something like a neck collar, a cervical collar, because if you don't move your neck, then it doesn't hurt, right? So the cervical collar helps protect you from the pain. Now, the problem with all that is, although it does help, that strategy does help manage some of the pain, the acute pain that occurs with an acute or sudden ligament injury, that strategy actually more often than not delays or stops the appropriate healing process. So what do I mean by that? So certainly when you first get an injury, resting is perfectly reasonable. But should we be immobilizing? Should we be taking weight off of the ankle? Should we be using non-steroidal anti-inflammatory drugs? And the answer actually most of the time is no. Now there are certain circumstances where we want to certainly take precautions. If there is a circumstance where we've actually have a fracture of a bone associated with the ankle, or if we have complete instability of the knee because something has torn substantially, or if we have a severe neck injury that's involving fractured bones or things along those lines, then those may certainly be situations where immobilization is a good route. However, Right? If we just take the example of a sprained ankle, if you completely immobilize that ankle and you take all these anti-inflammatory medications, we're decreasing inflammation, but inflammation is actually the first part of healing. And that inflammation should come, and then the body is a sophisticated, beautiful thing. That body will allow that inflammation to come, and then that body will get rid of that inflammation. In addition, part of that inflammation coming and going, that's the body that's, sending cells over there to get rid of the damaged tissue, and that's sending your local stem cells into the area to conduct the healing process. And as that healing process is taking place, if we're completely immobilized, the body's not going to know how to heal in the appropriate way. So if your body is used to moving this elbow, then we need the tissues around the elbow to heal as it's going through those motions. If we keep that elbow in this position and do not move it, well, then the body's going to heal statically in that position, whereas it is actually a dynamic joint. So that's why we get improper healing that takes place of these ligament structures, and that's why things like a rolled ankle ends up being something that we can easily re-injure over and over and over again, right? Once you've sprained your ankle, chances are you're going to sprain it again multiple times. And this ends up being a big issue, and that's why there has been a paradigm shift. There has been a change in the way that we manage acute ligament injuries at this juncture. First, we do have to identify if there are major tears of the ligaments going on or if there's fractures or other injuries that are a piece of the puzzle. But barring that, once we figure out that that's not a piece of the pie, and once we realize that the injury to the ligament is minor or is in a situation that may be able to potentially heal on its own, well, then we actually take a different strategy. Instead of using an anti-inflammatory pain medication that's actually going to stop the healing process, we can use pain medications like Tylenol or even opioid pain medications for short-term use to decrease some of the pain associated with the ligaments. But instead of immobility, after that initial rest, we actually start to get back to moving again. Because if we don't move appropriately, the body's not going to know how to heal in the correct manner. We need to heal in a functional manner, and that ends up being very important. So getting back to mobility in something like physical therapy and exercise ends up being the number one most important component of treating ligamentous conditions. And that goes for whether it's a sprained ankle, an injured knee ligament, or even a whiplash condition. In fact, I would argue that it is very, very important for whiplash conditions, even though the standard that we think about for whiplash conditions is immobilization, and then actually going towards something like chiropractic treatments, which I'll get to in a second. So the very most important, most fundamental component of treating acute ligament injuries is something like physical therapy and exercise. We want to get the body moving correctly. We want to strengthen the muscles around the joint to provide stability while the ligament is healing. And ultimately, that getting back to functional movement is the thing that's going to provide us not only short-term but long-term benefit. So, Dr. Patel, what about things that are not acute injuries, right? What about things like chronic sprains? Like we've had multiple sprains of the ankle before. Or what about hypermobility conditions, right? Hypermobility, as we discussed in another video, is when your rubber bands are normally a little bit looser, right? So if your rubber bands are normally a little bit looser, then that causes us to have extra motion in areas, which causes the muscles to tighten and spasm up. Right? So what about those type of conditions? Well, even more important for us to make sure that we get the muscles firing properly. Because now if this is a chronic condition, this is something that's been going on for a long time, well, you better believe the muscles have now learned behaviors, learned patterns of movement that are actually not appropriate. So we need to actually get those muscles to relax, but also get those muscles to start firing in the appropriate patterns, start firing correctly. And then we can get, again, some stability back to the joint and get the body moving correctly. Now, what happens to the ligaments themselves? Are the exercises we are doing, do those actually strengthen the ligaments? Can your physical therapy exercises actually help with strengthening these ligaments that have been stretched, pulled, or torn? The answer to that is actually no. Now, a lot of ligaments have good blood flow, good blood supply. So ligament injuries can actually heal on their own. So the point of the exercise is to strengthen the joint, provide stability, keep things together, get the body moving correctly, and then allow the ligaments the opportunity to heal on its own. And if it is a chronic condition, or if it is a more significant tear and the ligament is not able to heal on its own, there are some various different types of treatments that can be done could help that healing process. And I'll get to that in a second. But going back to something like whiplash, unfortunately, whiplash, especially with things like motor vehicle accidents or job injuries or various other injuries, unfortunately, whiplash falls into that category of injuries that ends up getting tied into personal injury cases. And personal injury cases are situations where, I got in a car accident. It's that, person's fault that rear-ended me. Now I got a lawyer up, and now we got to figure out, all right, how are we going to cover my medical expenses and the damage to the car and all that kind of stuff. Now, unfortunately, these type of situations, oftentimes the medical care ends up getting dictated by the system rather than focusing on the medicine and the health of the patient. What I mean by that is when you end up, getting into that personal injury world, there are a lot of great lawyers out there, but there are some lawyers that are focused more on, all right, how do we maximize the amount of potential funds or money that we can get out of this lawsuit. So the type of treatments that are done are then tailored towards that goal rather than the improvement of the patient's condition. And unfortunately, because of the system, even good lawyers end up relegated to sending patients down that PI algorithm, so to speak. And that algorithm is not necessarily the best for a lot of conditions, but particularly ligament conditions and particularly whiplash. Why do I say that? The most often the first treatments that patients end up going to for somebody that has neck pain after a whiplash injury is actually something like chiropractic care. Chiropractic care can actually be really good for whiplash conditions or absolutely horrible. So there are some fantastic chiropractors that when in the situation of whiplash will do soft tissue manipulation to relax the muscles and to get the spine gently in an appropriate position, and then send or then either teach exercises or send to a physical therapist that'll then strengthen the muscles throughout the region. And that would be a very appropriate management strategy. However, unfortunately, when it comes to these personal injury cases, there are a lot of these chiropractors and other manual therapists that will go towards what are the short-term things that could provide benefit or improvement. So oftentimes resort to these cracking type maneuvers, these high velocity adjustments that cause a crack, and may release some endorphins and make you feel better temporarily. However, doing these treatments, and especially doing these treatments repetitively, can actually cause the ligament injuries to get worse. So imagine if these ligaments have been stretched, and now you're taking it towards that stretched position and crack, stretching it more over and over and over again. There is a such thing as over-manipulation syndrome. And that's ultimately that the ligaments have gotten looser due to treatment. Even though there's temporary benefit potentially, long term we end up having more instability and therefore more issues. especially when these chiropractic or other manual therapy manipulations, these high velocity direct maneuvers, are not coupled with the appropriate exercise and strengthening of these muscles. Well, that's like a double whammy right there, right? So number one thing to avoid when we have ligament injuries are things like the non-steroidal anti-inflammatory drugs that are going to stop the healing process. Number two are things like complete immobilization of the joint or the injured area, because then the muscles are not going to fire properly. But number three things to avoid would be excessive or even any high velocity cracking type maneuvers by a chiropractor or other manual therapist. The number one thing that we do want to do, again, is the physical therapy, the exercise, the strengthening, the functional movement. That really should be our number one treatment. And then for treating the ligaments specifically, if the ligaments are loose chronically from repetitive injury, repetitive sprains or things like that, or if you have hypermobility, or if we have partial thickness tears of ligaments, or even in some situations when we have full thickness tears of ligaments, there are things that we can do using things like prolotherapy, sugar water injections, using things like a patient's own orthobiologics like PRP or platelet-rich plasma, or in rare situations, even using things like a patient's own bone marrow that contains cell therapy. These things could actually be injected with precise image guidance directly to the ligament structures to actually cause some level of healing to take place. We even have cases of things like partial thickness and even some full thickness ACL tears of the knee that have actually been able to heal using a patient's own orthobiologics. But certainly even hypermobility cases, Ehlers-Danlos syndrome, whiplash, chronic sprains, and these are things that could really benefit from injections of things like prolotherapy and PRP. And how do these things work? Well, those are topics that I've covered on multiple times before, and I have topics on prolotherapy and ligament treatments in the past, but ultimately we are inducing some level of healing to take place in various different ways, and that really can be beneficial for certain ligament conditions. Some conditions may actually require surgery. If we have a ligament tear and that ligament is all cockeyed now, flapping in the wind, and there's no adjoining fibers there, or if there's substantial instability, or if there's a fracture that's associated with the ligament injury, well, these are things that might actually need an orthopedic surgeon to provide some external or internal stability to the area. And in doing so, that could provide some significant improvement in the stability and prevent things from getting worse. However, we do want to make sure we're pumping our brakes and making sure that the surgery is absolutely necessary, because there are a lot of non-surgical things that can be done to provide benefit for these type of situations. Now, hypermobility is a unique scenario, particularly if it's a genetic type of hypermobility, like hypermobility type Ehlers-Danlos syndrome. These are conditions that even if we have an acute injury, oftentimes there is this chronic genetic underlying looseness to the ligaments that's a piece of the puzzle. So these are the type of situations where we want to be comprehensive and treat the specific injury, but also we want to think about things like maintenance. We want to be able to treat these ligament structures on a regular basis. We want to get back to strengthening the muscles on a regular basis, and this ends up being a very, very important thing for long-term care. So ultimately, ligaments are the duct tape that connects bone to bone, but actually like those thick rubber bands that surround broccoli in the grocery store. Ligament injuries can be repetitive stuff that goes on over time. It could be repeated injuries that have taken place, or it could be acute injuries. And ligaments can get involved with situations with genetic conditions such as Ehlers-Danlos syndrome and hypermobility. And ultimately, there are things that we should avoid, but there's a lot of things that we can do. The paradigm shift has occurred. We're no longer immobilizing and using anti-inflammatory medications. Instead, we want to control the pain and get the body moving. And in some situations, use your own body's ability to heal to get those ligaments to function correctly. I hope that all made sense. I'm going to look at my comments here. Kathy, thank you so much for joining us, Kathy. Appreciate the kind words. You're always so wonderful. Appreciate you so much. Kathy mentioned my daughter was just in 2 back-to-back car accidents. I'm so sorry to hear about that. Unfortunately, that's the type of thing that certainly can cause some repetitive injuries. But the good news is that, again, if we can get back to motion, if we get back to moving appropriately, even that can be something that could be healed and managed in great ways. João Paulo, Doc, great to see you joining. You've been fantastic. I haven't seen or talked to you in a long time. I hope you're going to be joining us at Toby. This is going to be fun this year. Glad to be in person in conferences again and all of that. But overall, thank you all for joining. I hope you enjoyed this. If you have any questions about this, you can feel free to comment or DM or email us at info@fxregencenter.com. If you have other topics that you want me to address, if I confuse the heck out of you out of this talk and you want me to talk about it again, or if there's anything else that you want me to go over, then please feel free to contact us with suggestions. Stay safe, everyone. I hope everyone is doing well. If you have any questions for me personally, you can always reach out. And I hope you guys have a good holiday weekend if you celebrate. I know we don't celebrate religiously, but we're definitely going to be hiding some Easter eggs for the kiddos, so it's going to be fun. Wishing you all the best. Have a happy Friday and a happy weekend. Have a great week ahead, and I hope to be planning to see you again next week. Have a great weekend.